Namaste and good afternoon, everybody. I'm Susan Rana and your moderator for the program today. I'm very pleased to welcome you all to this program today. And we are talking about AMR today, actually, the antimicrobial resistance. It is the cause of deaths of more than 700,000 people annually in the world. It has been estimated that this death toll will go as high as 10 million by 2050. The economic losses is estimated to stand at around 100 trillion US dollars by 2050. Having said this, we all can realize that the worst hit by this problem will be the developing nations. Keeping this in mind, the World Health Organization developed the Global Action Plan on AMR in cooperation with FAO and OIE in 2015. And following that, these organizations, along with the UNEP, have entered into the Tripartite Plus Memorandum of Understanding for coordinated efforts to combat AMR. We all realize that threat anywhere is a threat everywhere, and bigger goals can only be achieved when we work hand in hand, when we have better collaboration, and when we have better coordination among the cross sectors. So this program is actually a stone added to the fight to the AMR. And as for Nepal, Nepal is also moving forward towards the approval of the National Action Plan on AMR. People from multiple sectors came together, sat down together, discussed together, and have drafted a National Action Plan. And we are quite in the verge of approval of the action plan by the Council of Ministers. So this program today is actually rightly conducted at the right time, I would say. And I would again like to welcome the representatives of the organizing institutions, speakers, panelists, and all the participants to this webinar on fighting the invisible pandemic of antimicrobial resistance, veterinarians and the One Health approach on food security and food safety for a healthy life, jointly organized by the Food and Agriculture Organization of the United Nations, Federation of Asian Veterinary Associations, Nepal Veterinary Association, VNU, and the World Antimicrobial Awareness Week 2021. Welcome, everybody. And before we actually start the program, we have some housekeeping announcements. Attendees are encouraged to use the Q&A box to drop their questions to the speakers. And there is this provision of providing the e-certificates provided that your attendance is over 80%. So now, without much further ado, let's now move on to the opening session of the program. And we have 3 opening remarks in this session. And I would first like to request the President of the Federation of Asian Veterinary Associations, Dr. Khwaja Nizamuddin bin Hassan Nizam, for his opening remarks.
Thank you, Dr. Sujan Rana, for the kind introduction. Greetings to all veterinarians, farmers, and industry players in the livestock sector. I warmly welcome everyone to this webinar entitled Fighting the Invisible Pandemic of AMR, Veterinarians and the One Health Approach on Food Safety for a Healthy Life. It is indeed an honor and privilege to speak at this event. The webinar is organized in collaboration with FAO, FAWA, the Nepal Veterinary Association, and VNU Asia Pacific Exhibition Services. I welcome Dr. Kachen Wongsataponchai from FAO and the President of the Nepal Veterinary Association, Dr. Sital Kaji Shrestha, who are with us. Also today, we have 3 prominent speakers to share their knowledge and expertise. That is Dr. Mary Joy Gordon-Silo from FAO, Dr. Jing Wang from OIE, and Dr. Barun Kumar Sharma from the Ministry of Agriculture and Livestock Development, Nepal. Ladies and gentlemen, FAWA, or the Federation of Asian Veterinary Association, is a 27-member association comprising of 24 member countries in the Asia-Oceania region, with 2 associate and 1 affiliate members. The outreach is more than 100,000 veterinarians. FAO plays an important role in working with national veterinary associations to carry out programs, projects, and activities to benefit member associations. Ladies and gentlemen, we at FAO are collaborating closely with FAO to carry out various strategies to enhance the understanding as well as overcoming AMR issues both at the national and at the regional level. This year, the collaborative project is titled Empowering Veterinarians in Asia Towards Fulfilling Their Roles on the Global Action Plan on Antimicrobial Resistance. Strategic objectives have been laid out with clear outputs. Probably Dr. Mary Joy Gordon-Silo from FAO may present on this. In any case, we will deliberate it during the panel discussion. Ladies and gentlemen, antimicrobial stewardship is not limited to antibiotics, but it also encompasses antiviral, antifungal, and antiprotozoal. This invincible pandemic, if not controlled, can cause 10 million people to die in 2050, with losses amounting to $100 trillion to the global economy. The health of people is very much connected to the health of animals and the environment. When antibiotics are used in animal production at the sub-therapeutic levels and over a long period as in growth promoters, it creates an ideal situation for bacteria to fix genes that confer resistance. This was already evident in the reporting of colistin resistance gene found in pigs in China. Also, antibiotic-resistant bacteria may colonize the human intestinal tract and contribute resistant genes to the human endogenous flora. Ladies and gentlemen, from the food safety standpoint, a study from an Asian country showed that E. coli isolates from chicken meat show resistance to ampicillin, 75% of the samples, to tetracycline, 69%, ciprofloxacin, 65%, and trimethoprim, 41%. Antibiotic residues and resistance were detected in 13 out of 26 samples. It was a worrisome 50% detection rate. Misuse and abuse of the antimicrobials is an important and substantial driver of AMR. Ladies and gentlemen, the threat is real, present, and dangerous. We need to protect the critically important antimicrobials used for humans to be phased out from use in livestock. We need to use antimicrobials responsibly and prudently. We need to improve farm biosecurity to prevent and minimize the introduction of pathogens into the farms. We need to explore the use of alternative products to replace antimicrobials, such as vaccines, prebiotics, probiotics, and enzymes. Ladies and gentlemen, we hope we can take the necessary and appropriate actions to stop the escalation of antimicrobial resistance before it is too late. The responsibility lies with us. So, are we part of the solution or the problem? Ladies and gentlemen, lastly, I'd like to take this opportunity to thank FAO, Nepal Veterinary Association, FAO, the speakers, Professor Dr. Acharya Shailasuta, for coordinating with our partner V&U Asia Pacific Exhibition Services to make this event happen. Thank you to all participants, and I wish you all a successful webinar, and together we'll try and make a difference. Stay safe and stay healthy.
Thank you so much, Dr. Nizam, for your opening remarks. Now, I would like to call upon Dr. Kachin Ongshata Ponchai, Regional Manager, Emergency Center for Transboundary Animal Diseases, FAO Regional Office for Asia and the Pacific, for his remarks.
First of all, thank you very much, Dr. Sujan, and I commend you for a very nice introduction, which actually highlights the importance of AMR. And also good afternoon to Dr. Kwaza for your very motivating speech earlier, Dr. Sital, Professor Dr. Acharya, and all the invited speakers. Good day and welcome everyone, of course, to the seminar on fighting the invisible pandemic of antimicrobial resistance, veterinarians and the One Health approach on food security and food safety for a healthy life. Well, the name of this seminar is a bit long, but I think it's quite catchy and timely and very appropriate, especially as we relate AMR as the existing pandemic. It is an honor for me to be invited to the opening session. I was told that we are having more than 300 participants registered to this seminar, and this is some impressive number, of course. It shows that AMR is really an important issue, not only for Nepal, but also regionally and globally. And everyone here is paying attention to it. I also understand that the majority of audiences here are members of the Nepal Veterinary Association, or NVA. So hello once again to my fellow veterinarians, as I am also a veterinarian myself. So this seminar is part of the series of seminars on AMR leading up to the World Antimicrobial Awareness Week, or WAAW 2021, which will take place in November of this year. And that FAO has an opportunity to collaborate with the Federation of ASEAN Veterinary Association of FAVA, and of course its members. This particular seminar hosted by Nepal is actually the second of the series. And I would like to thank the Nepal Veterinary Association, or NVA, for your collaboration and support. This is part of FAO's effort to empower veterinarians in Asia to fulfilling their roles and support the FAO Action Plan on AMR, which eventually contributes to the global AMR Action Plan. Every one of us here are crucial to our success in the fight against AMR through raising awareness, reinforcing surveillance, promoting good practices and prudent use, and strengthening overall governance on AMR. I see that we have the very knowledgeable speakers lining up that will provide you with useful information on your important contribution and how you may be able to support the global movement, so I won't say much. But as people often say, think globally, but act locally. So I wish to take this opportunity to thank FAVA and VNU Exhibition Asia Pacific for making arrangements for this seminar, and to thank NVA for their facilitation and support. Thank also to the invited speakers from FAO, OIE, and NVA, and of course, very important, thanks to all the participants who are here today. I wish we all learned something new and helpful, and I also wish you all good health. So take care, and thank you very much once again.
Thank you, Dr. Kachin, for your wonderful remarks. And now we move on to remarks by the President of the Nepal Veterinary Association, Dr. Sital Kaji Shrestha. Dr. Shrestha, the floor is yours.
Thank you, Dr. Susan Rana, for this introduction. My special thanks to FAVA President, Dr. Kwaza, and also to Dr. Acharya for facilitation of this webinar. Special thanks goes to the VNU team members for such a wonderful coordination. And on behalf of Nepal Veterinary Association and myself, I would like to invite all the participants in this today's webinar, where we are sharing a common platform by FAO, FAVA, VNU, and WAW 2021. Today we are here to learn more about the pandemics of antimicrobial resistance. Of course, it's very invisible, and the role that we as a vets have to play on food security part, on food safety part, and as a as a whole on One Health aspect. It's indeed our pleasure on behalf of Nepal Veterinary Association to be associated in this regional platform. And my special thanks to all the speakers who, agreed to be here to share the knowledge, especially with the Nepalese vets and vet students. So my sincere thanks to Dr. Mary Zoe from FAO Regional Office and Dr. Jing Wang from Y Region, and to our local presenter, Dr. Barun Kumar Sharma, who is from Ministry of Agriculture and Livestock Development. And as it was rightly said by Dr. Kwaza and Dr. Kachen, that this is indeed a bonding problem, and maybe this is the right time that we have been able to gather at least the veterinarians and vet students from the regional sector. So just to add few lines to Dr. Kwaza and Dr. Kachen, we should really focus on the prudent use of antimicrobials. We, as a member of this Asia, Far East, and Oceania countries, after 32 this Y members under this region, as far as I know, that around 50% of the countries are still using AGP in the feed. So this is one of the real challenges that we have been facing, especially in the developing countries. So this should be we should come forward with the ways to take the use of this AGP and the facilitation of prudent use of antimicrobials. And the other thing that I would like to emphasize is that unofficial use of antimicrobials in our day-to-day life. Officially, though, many countries have declared that there has been no use of antimicrobials, mainly in the form of AGPs. But as far as we know, and even as I know, that there is various unofficial use of antimicrobials, mainly in the form of AGPs, which has been a real threat in our world, which has been a threat from One Health perspective as well. And this we have to check at least regionally. And as it was said by our moderator, Dr. Susan Rana, even Nepal, we have come with the National Action Plan, and right now it's in the phase of revision. But what about the regional action plan that we can work together, so that that will be in conjunction with global action plan and national action plan? Maybe the Y regional office or the FAO regional office should take the lead in coming up with the regional action plan on fighting or combating these antimicrobial issues, at least in the region. And with this, again, lastly, I would like to thank Fao-Fava-Nva-Vnu exhibition for this wonderful platform. And my special thanks again to Dr. Kwaza, Dr. Acharya, and all the VNU members. And I also wish for the fruitful conduct of the seminar, of this webinar. Have a good day. Stay safe, stay healthy. Thank you so much.
Thank you so much, Dr. Sital. Thank you for your encouraging words. We are now moving on to the second part of this program today with the remarks of Dr. Shrestha. We have already ended the opening session and we are now entering the technical session. Actually, for the technical session, we have 3 invited speakers today. And the first talk is by Dr. Mary Zoe Gordon-Silo. Dr. Mary Zoe Gordon-Silo is the AMR Regional Project Coordinator at the Emergency Center for Transboundary Animal Disease Operations of the Food and Agriculture Organization Regional Office for Asia and the Pacific. She is involved in developing tools, strategies, and innovative solutions to mitigate AMR in the food and agriculture sector in Asia. Before joining FAO, she served as the Science and One Health Coordinator of the OIE Sub-Regional Representation for Southeast Asia. And before that, she worked as an assistant professor at the College of Veterinary Medicine University of the Philippines. She holds a Doctor of Veterinary Medicine degree from the University of the Philippines, Masters of Tropical Veterinary Science from James Cook University in Australia, and a PhD from Michigan State University, USA, where she actually specialized in the antimicrobial resistance in livestock. I now invite Dr. Mary for a talk on the Global Action Plan on Antimicrobial Resistance and the veterinary profession.
Good afternoon, colleagues from the Nepal Veterinary Association and also colleagues from the Federation of Asian Veterinary Associations. I am Mary Joy Gordon-Silio, another veterinarian from the FAO Regional Office for Asia and the Pacific. I coordinate the AMR Regional Project in FAO. For this afternoon, I'll be briefly talking about the Global Action Plan on AMR and our veterinary profession. So this is the basic outline of what I'll be talking about. I'll talk about a little bit of introduction, addressing AMR in the food and agriculture sector, the Global Action Plan on AMR, the veterinarians and the Global Action Plan AMR objectives, and veterinarians in the One Health approach to AMR. So before we get lost in the issue of antimicrobial resistance, let's take a quick look at the benefits of antimicrobial use in animals and why we need to keep them working for our purposes as veterinarians. So first and foremost, of course, antimicrobials in animals are tools for maintaining well-being of animals. It helps in reducing animal pain and suffering, and it also, of course, reinforces animal welfare as we use this as a treatment, as medical substances for the animals that we treat. This is also important for assuring that we continue to produce foods of animal origin for food, and also to protect the livelihood of farmers as animal resources that we treat. So in short, the use of antimicrobials are used for economic benefits for the food animal producers. And lastly, antimicrobials are also our tools for more secure and safer public health. We use antimicrobials to prevent, to make sure that we reduce the risk for shedding of zoonotic bacteria into the environment and the food chain. And by the proper use, we continue to prevent potential large-scale epidemics that would result in severe loss of animals and human lives. So these are some of the benefits of antimicrobial use in animals that will help us recognize somehow, why we need to keep these medical substances working. Now, however, of course, things have changed. They have been used, misused, and abused. And let me just take you back into this historical background of antimicrobial use in animals for us to have the perspective of how this use evolved over time. It was in the 1940s that antimicrobial sulfonamide was first introduced to food animal medicine. They started preparing, a lyophilized penicillin, and they were made to use as intramammary infusion for treatment of bovine mastitis. However, in 1948 was an interesting turning point because Stockers and Jukes accidentally discovered the growth-enhancing effect of cellular remains of Streptomyces orophaciens. During this time, there was post-World War II, there was a clamor for more improved production because during the period of hunger, they wanted to make sure that during this time, they were able to produce sufficient food and protein for the growing population. And so there were a lot of research invested on looking at how to enhance growth. Now, they were looking at vitamin B12 originally, which they were producing trying to extract vitamin B12 from bacteria. However, some shell casings that they were not able to use, they threw away, and then suddenly realized the chickens were growing faster than normal. And they were, true enough, when they monitored, the subtherapeutic levels of antimicrobials seemed to have an effect on the growth promoting actions of these antimicrobials. And from then on, starting the 1950s, there were subsequent discoveries on the availabilities of newer antibiotics, but it also started widespread therapeutic use for a multitude of infectious diseases in virtually all food animal species. Between 1950s and 1960s, it was the first approval of the use of antibiotic as animal additives without veterinary prescription in various countries. This was the period where there was rampant discoveries, excitement on this new use and all that. But in the 1960s, late 1960s, a released report by SWAN, or what you call now as a SWAN report, was issued highlighting that the therapeutic use of antibiotics in farm animals posed certain hazards to human and animal health. So this started the debate and the discussions on whether subtherapeutic use should still be continued to be in use. And so starting from 1970s, there were already some consciousness, so Europe started banning the use of tetracycline, penicillin, and streptomycin for growth promotion. In the 1980s, some countries started prohibiting the use of additives that's classified as antibiotics. And then I think it was in the 1990s that they started to report findings of glycopeptide-resistant enterococci from food animals, which led to subsequent bans of avoparcin. Avoparcin is a molecular equivalent of vancomycin, another glycopeptide, which is clinically important for use in the hospital for treatments. They used to just find vancomycin-resistant enterococci in hospital settings where they are frequently used. When they started seeing community VREs, they were wondering why would people who have no exposure to hospitals, who have not been treated, who have not been hospitalized, would develop VRE. And so they look at the possible sources and trace this back to the use of avoparcin, which is another glycopeptide that's used as a growth promoter in food animals. So this triggered a lot of discussions on this theme. Now, in 2006, antibiotics other than coccidiostads and histomonostats were deleted from the registered authorized feed additives in Europe. And then the next decade, we saw a lot of transition. There was a lot of changes, which was triggered largely. The culminating point was the development and the endorsement of the Global Action Plan on AMR by the World Health Assembly of the WHO. This was followed shortly by the endorsement of the World Assembly of OIE delegates and the FAO Global Conference of the same action plan, global plan. And as you can see, there's a cohesive work that's being done across the globe from both sectors, the human health sectors and from the animal health sector, working on addressing antimicrobial resistance. Now, 2020s, we are currently defining 2020. So our actions today will be the defining moment of how we conclude, how the history will remember the 2020s in this section. So regardless of wherever you are, whether you're in Nepal or you're working in a farm in Nepal or working elsewhere, your contributions to this work as a veterinarian will define how we will develop the history of antimicrobial use in animals in the future. Now, of course, this evolving use of antimicrobials, not only in animals but also in humans, contribute to the emergence and spread of antimicrobial resistance in humans and animals. So this diagram illustrates that antimicrobial resistance in humans and animals are not only linked to the antimicrobial use in animals, nor is it only linked to the human usage, but both contributing to this pool of work. Now, increased mortality, what are the impacts and what are the impacts of emergence and spread of AMR? AMR leads to increased mortality because they are more difficult to treat, increased morbidity because they are easier to because of the length of the period of infection, there's more people that can get infected, more animals that can get infected, and reduce efficacy of related antibiotics, as we can see, as I mentioned about the avoparcin story. This also leads to healthcare costs because of the longer stays in hospitals and increased carriage and dissemination, where resistant bacteria leaves uncontrolled. And of course, infection in animals, this facilitates further emergence of antimicrobial resistance. From the agricultural perspective, AMR can also compromise livelihood and food security. It can also support the spread of zoonosis and, of course, compromise animal welfare. Try to protect. So these are some of the consequences of antimicrobial resistance that's contributed both ways from animal and human health sector. Now, as a recognized complex issue, AMR is best addressed with a well-covered and well-linked force from all relevant disciplines, which we know now as a One Health approach. It is thus imperative to bring together and have an understanding of and respect for each and every relevant expertise. The united and cohesive approach to address AMR will ensure that all areas of concern, regardless of how diverse they may be, are well addressed by the interdisciplinary nature of a One Health initiative in the countries. This means that as a veterinarian, we will focus on how we can address AMR in our sector of interest, while the other sectors, like medical doctors, focusing on how they can reduce their work. It's like neighbors trying to address our own backyard and coming together, of course, in areas where we converge. So just to illustrate this example, there are issues and concerns, of course, in both animal and human health sector, but there are also shared issues and concerns between the two. This interface is where we leverage collaboration and strengthening respective services, strengthening animal health services, veterinary services for the animal health sector, and strengthening health services for the human health sector. These are keys by which we can address not only AMR but other cross-cutting health issues for both disciplines. But what we need also is a strengthened coordination mechanism by which communication, synergistic approach to this work is facilitated. So we need this strengthened coordination mechanism as well. But what is important is that individually we make ourselves strong, and also collectively we gather together to become stronger. So it's like creating an orchestra with fine musicians, a fine violinists trained in what they're supposed to be good at. People who are, musicians trained in cello, in strings, or in other instruments that they are experts on their own instruments. But when they come together in a harmonious way. And One Health is somehow similar to an orchestra where we bring together each our piece of instrument. Because for a setting where regardless of the expertise or regardless of how expert you are, but we don't come together as one, we still create noise in this way. And what would be much worse is that if you're a bad instrumentalist or a bad musician, joining an orchestra would be a terrible idea. So you can see we can look at One Health in that way. Now, let's have a closer look, have the perspectives between and across health sectors, just to show the starting differences for each. For setting of concern, for animal health sector, of course, it will be the animal farms, animal hospitals, and clinics, or other areas where, livestock, ponds, aquaculture ponds, and that. For the human health sector, it will be the hospitals, health facilities, homes. But at the interface where animals and humans converge, this would be a shared area of concern. So this is the community, the environment, maybe market and trade setting, or homes of animal owners. So these are where both the animals and humans converge, and so this becomes a shared concern for respective sectors. When we talk about examples of issues of concern, it doesn't necessarily mean that any AMR incident is always linked to animal health sector. For example, there are specific issues that's within the animal health sectors. For example, antibiotic resistance in mastitis. Failure of treatment to mastitis would lead to reduced, and so the economic consequences and all that. It doesn't necessarily translate as a risk to humans, but of course, it's a productivity concern. Now, resistance to antiparasitics is also another example, especially in Asia, where this is quite common, and rampant use of antiparasitics is quite common. And of course, other antibiotic resistance events in animal pathogens. These are concerns, example issues of concern in the animal health sector. Likewise, in the human health sector, there's the multi-drug resistant tuberculosis, extremely drug-resistant tuberculosis, resistance to antiviral drugs, where animals have little to contribute to. However, at the convergence point, at the interface, there's the community-acquired methicillin-resistant Staphylococcus aureus. There's community-acquired vancomycin-resistant enterococci. And of course, there's potential for horizontal gene transfers across organisms. So at the convergence point, at the interface, these are the shared concerns between the animal and human health sector. But what's important to note here is that not every AMR concern, either in animals or in humans, are a shared concern. So maybe that's important to note. Now, what are the sectoral issues that contribute to the global AMR issues? As you can see here, like even individually for each health sector, for animal and human health sector, the same sectoral issues contribute to the global AMR issue. There's antimicrobial abuse and misuse in animals and in humans, circulation of drugs with suboptimal quality, including counterfeit drugs, lack of veterinary oversight, weak animal health services, and poor waste management. So both these contribute to the global AMR issue. Both are coming from each sector. At the interface, the shared concern will be uncontrolled spillover from both sides, poorly managed environment, which facilitates further spread of resistance genes or resistant organisms or residues, lack of containment leading to continued access with animal and human environment, and actions that reinforce potentials for horizontal gene transmission or horizontal gene transfers. Now, the Global Action Plan on antimicrobial resistance, just as a brief history, during the 68th World Health Assembly in May 2015, the WHO resolution endorsed the Antimicrobial Resistance Global Action Plan on Antimicrobial Resistance. Shortly after, this was followed by the endorsement of OIE delegates, majority of them of which are chief veterinary officers of its more than 180 member countries around the world, convened and endorsed combating antimicrobial resistance and promoting the prudent use of antimicrobial agents in animals. And similarly, in June 2015, the Food and Agriculture Organization of the United Nations also collectively endorsed and adopted the resolution on antimicrobial resistance in food, agriculture, and the environment. This allows us to see that cross-sectorally, there is not the emergence of the global concern for AMR has started to emerge. These global resolutions catalyzed the global work on antimicrobial resistance because of its, of course, significant public health issue. Now, Global Action Plan has 5 strategic objectives: improving awareness and understanding, strengthening knowledge and evidence through surveillance and research, reducing the incidence of infection, optimizing the antimicrobial medicine, and developing the economic case. Across these 5 strategies, FAO also has developed an FAO action plan that translates the same 5 objectives for food and agriculture. So when you look at this global action plan, the FAO action plan is similar, but it's focused specifically on food and agriculture, including crops. So what are the roles of veterinarians to this global action plan on AMR? First, let's take a look at the first objective. For the animal health sector, we need to improve AMR awareness and understanding. But the first thing is that we need to know who our target audience. For the animal health sector, of course, these are our stakeholders, animal production stakeholders such as farmers, traders, etc. Also veterinary students, veterinarians, the animal industry, the national vet services, including both public and private, and the National Vet Authority. Likewise, in human health sector, they have their target audience. These are the healthcare stakeholders, medical students, doctors, prescribers, national health services of both public and private, and National Health Authority. At the convergence point, there's the general public, there's the community, environmental health stakeholders, National Environment Authority, and promote information sharing. So the resolution that we could do, these are, the shared, the interface is the shared community or the shared target audience. What you need to do is to promote information sharing and platform for exchanges. So while the animal health sector will target our specific stakeholders and human health sector target their specific stakeholders, we should also jointly target this target audience at our interface. And how do we do this? We can help collaboratively promote information sharing and platform for exchanges. And so specifically, our main emphasis would be to have one voice as veterinarians, targeting our stakeholders, having a shared common messages, having the information that we need to communicate and raise awareness and advocate for actions towards antimicrobial resistance. So these are our stakeholders and targets of concern. Now, for strategic objective 2 of the Global Action Plan, viewed from a veterinary lens, animal health sector and human health sector are pretty much the same. Strategic AMR surveillance and research in setting of concern, laboratory strengthening to support surveillance, use of surveillance research findings on risk analysis. These are areas or activities that we can support. Veterinarians supporting the animal health sectors, medical doctors supporting the human health sector. But also at the interface, we need to have a strategic AMR surveillance and research in settings of concern, laboratory strengthening to support surveillance, use of surveillance research findings on risk analysis as well, and promoting information sharing and platform for exchanges. And this is how integrated AMR surveillance is important in this conversation, because what we need to be conscious about is that we need to focus on the areas that we need to be concentrating on, but at the same time cognizant that there are other disciplines where we need to be also contributing. So this is an example of an integrated surveillance, which taken from this, as you can see, what are the important areas for veterinarians. This we can contribute with focusing or supporting AMR monitoring and surveillance in bacteria from healthy food animals and their products, or supporting antimicrobial residues monitoring. We can also support by helping in monitoring or contributing to monitoring surveillance in bacterial pathogens from diseased livestock and diseased aquatic animals. And also, of course, monitoring antimicrobial use at the farm or even at the national level. And also, having an understanding of the knowledge, attitude, and practices in the use of antimicrobials in food and agriculture. So these are the areas where veterinarians can contribute. For reduction of incidence of infection, you can imagine that for this, it's the same. If animal health sector focusing on reducing infection in our settings of interest, like the farms, animal hospitals, and where we work with as veterinarians. It also involves use of vaccines against endemic and disease issues. Similarly, for the human health sector, it entails strict implementation of infection prevention and control protocols in hospitals, in homes, in care facilities, and of course the use of vaccines against common human infections. Now, reduction of infection at the interface might take a different approach. It will involve waste management, effective interface segregation and containment, facilitation of safe trade and food, maybe also water sanitation and hygiene where this is relevant, but most importantly, promoting information sharing and platform for exchanges across the sectors. Now, this is just to illustrate what we can do for as veterinarians in terms of promoting vaccination, biosecurity, cleaning and disinfection, just to protect our target population, which are pretty much animals, for the from infection. This allows us to reduce not only the infection, but consequently reduce the need for unwarranted use of antimicrobials, because this allows us to reduce the need, as you know, like in most instances, when there's an infection, the first tendency is to pour antimicrobials and hope that it will work. Try and miss. And by this practice, this is where the problem begins, because unwarranted use, excessive use, triggers antimicrobial resistance, emergence, and further spread. Now, in terms of prudent use or optimizing the use of antimicrobials in human and animal health sector, I think it's the same approach for both the two health sectors, which includes good governance, quality assurance of antimicrobials, the practice of prudent use and antimicrobial stewardship, and having a reinforcing environment that will support prudent use of antimicrobials in animals, and of course for human health sector in humans. At the interface, we promote intersectoral coordination, collaboration, and again promote information sharing and platform for exchanges, so experiences are made synergistically relevant. There are several mechanisms or several elements in promoting optimal use of antimicrobials in the animals. And all of these are important: access to high quality antimicrobials, access to laboratory testing, access to well-trained veterinarians, updated treatment guidelines, access to appropriate antimicrobials, regulatory framework in place, and well-informed end users, and availability for needed information. There might be others, but these are all like contributing to optimal use of antimicrobials in the animals. Contributing to this, to any of this, allows us to contribute also to advancing antimicrobial resistance mitigation activities around the world. Now, for the last objective, again, similarly, it's about advocating funding for initiatives that will address antimicrobial resistance, promoting public-private partnership, promoting bilateral and regional cooperation between veterinary services, and advocating for research investment, new medicines, diagnostic tools, and vaccines, both for animals and human health. So this is creating and developing the economic case for sustainable investment. At the interface, we develop and advocate funding for a costed national action plan that integrates plans to address AMR issues at the human-animal health interface, and of course, promoting intersectoral coordination and collaboration, and promoting information sharing and platform for exchanges. So this is where a healthy One Health relationship will help expedite the work that are being done collectively to develop sustainable investments in the countries. Now, just as a case example, perhaps this is something where veterinary clusters, such as your veterinary association or other veterinary professional groups and networks or other organized veterans can strongly contribute. As a group, you should speak with one voice and cohesively work towards reinforcing the recognized accountability of the veterinary profession to support Global Action Plan for AMR. Today's discussion might be, a contributing step, but maybe there are other in the horizon that we can do to contribute to this more strongly and more elaborately. There is a need to also ensure that while the public health is placed at the fore, the commitments of veterinarians to ensuring food security, animal welfare, and protecting animal health are also maintained. Now, in summary, veterinarians can contribute through raising awareness and advocacy, improving AMR awareness and understanding in the animal sector. We need to have a cohesive message, a common message, a shared message, and a correct message, of course. In surveillance and research, veterinarians can contribute to any of the areas, where of integrated AMR surveillance or specific surveillance to our target sector, the animal health sector, by contributing from sample collection to processing to data analysis to data utilization. We're part and parcel of the surveillance and research support. Now, a very strong contribution is promoting reducing the incidence of infection in livestock and agriculture. So veterinarians are at the cornerstone of infection prevention and control, in biosecurity, in proper vaccination, in promoting animal health, preventing transboundary animal diseases from the farm level down at the broader regional transboundary levels. This will be very important. Responsible use is also important, of course, and we can contribute, by promoting and optimizing the use of antimicrobials in animal health. Our own practices will help. Having veterinarians, high-quality veterinarians with good grounding on proper antimicrobial use will be critical. And of course, overall, sustainable investment through sustainable investment and advocacy on investments would be very, very helpful. Now, in summary, as a global issue that cuts across various disciplines and sectors, AMR calls for a shared, well-orchestrated response across the world. It requires a whole-of-society engagement with all sectors and disciplines working together towards implementation of the action plan. Thus, it should be highlighted that while some of the potential roles of veterinarians in the Global Action Plan of AMR are emphasized here, the need for an effective One Health approach is also underscored. We are all in this together. As veterinarians, we are contributing to the One Health approach. And how do we do this? This involves coordination among numerous international sectors and actors, public and private sectors, multidisciplinary teams from human and veterinary medicine, agriculture, finance, environment, well-informed consumers, and others. So it's working together. But as veterinarians, we surely have a strong contribution to the potential use of or potential actions to address AMR globally. Now, of course, you're not alone on this journey. We are all in this together, Veterinarians of Asia, FAVA, and of course, FAO. Just to highlight here that the FAO Action Plan is largely drawn from the Global Action Plan. This is specific to food and agriculture. And from the Global FAO Action Plan, we actually are in the process of developing the FAO regional strategy. How do we cascade down the actions, the 5 actions, in the region? And similarly to the Global Action Plan that we have discussed, this is about increasing awareness, engagement, surveillance, and strengthening surveillance and research, promoting good practices, promoting responsible use, and strengthening governance. The FAO Action Plan targets that food and agriculture sectors, dependent livelihoods, and economies are made resilient to the impacts of AMR. So your actions are all well-grounded and well-supported with the collective support, not only from us in the region, but also globally. So you're part of a global community that's trying to address antimicrobial resistance globally. With that, I thank you. I thank everyone for this period, and I hope everyone is keeping safe and staying healthy and staying happy. Thank you, and have a good day, everyone.
Thank you, Dr. Mary, for your illustrative and insightful presentation, and thank you for your timely presentation too. So I would like to ask all the attendees to place or drop their questions in the question and answer box should they have questions to the speakers. And I would also like to request the speakers to address the questions, if possible, in the question and answer box itself. So we now move on to another presentation. The another presentation is by Dr. Jing Wang on overview of antimicrobial resistance in on how to combat AMR using a One Health approach. So Dr. Jing Wang joined the OIE regional representation for Asia and the Pacific back in May 2017 as a regional veterinary officer in charge of antimicrobial resistance and antimicrobial use and laboratory capacity building activities. She graduated as a doctor of veterinary medicine from China Agriculture University, and she has her master's degree in preventive veterinary medicine from the same university. Her major responsibilities at the OIE-RRAP include implementing regional programs relating to antimicrobial resistance and antimicrobial use, and capacity building activities for national veterinary services, particularly those in collaboration with the OIE reference centers in the region. Dr. Wang has organized several in-country workshops on monitoring of quantities and usage patterns of antimicrobial agents used in animals in South Asia, AMR laboratory hands-on trainings, and webinars on responsible and prudent antimicrobial use in aquatic animals. Prior to joining OIE, she served for China Animal Disease Control Center for several years as assistant professor, focusing on animal diseases, laboratory diagnosis, as well as laboratory quality management. We now proceed with the presentation on how to combat AMR using a One Health approach by Dr. Jing Wang.
Thank you very much, Dr. Rana, for introducing me. And I just would like to share my screen now. So thank you very much for the organizer inviting us. And also, I'm very happy to attend this very important AMR awareness raising activities and to share why we need to combine AMR using a One Health approach and share some regional and in-country activities relating to AMR with all the participants today. So here, this picture show you the global projected consumption of protein from animal source food in 2013. So this documents is developed by FAO, and their projections suggest that global meat production and consumption will rise from 232 million tons in 2000 to 300 million tons in 2020. Because there's a significant increase of consumption of animal protein. So this need a very intensive animal production system. And however, this intensive system rely on regular use of antimicrobials to maintain healthy and productivity on farm. And because of this routine use of antimicrobials, this will facilitate the development of antimicrobial resistance, which is a growing threat to the global health of humans and animals. So these slides show you the WHO documents that project the deaths that may caused by AMR in 2050 if no action taken. And there is also another projection shows that for each region, how many deaths it will attribute to AMR by 2015. Here we can see Asia, actually AMR will cause more than 4 million deaths by 2050, which is the biggest reason that will cause lots of people die due to AMR. If we look more into the national level, I know this meeting is in collaboration with Nepal. So I just searched some research papers regarding the AMR situation in Nepal. I think there's one research paper in 2019. It warns that the bacteria pathogens are becoming highly resistant to most first and some second line antibiotics. I think this can partly caused by the imprudent use of antimicrobials in human, animal, and crop sectors, and these are leading the cause of AMR in Nepal. So these slides show you the how AMR and AMR gene exist in the world and how it interacts with different sectors. So I hope you can see here AMR is a very complex and very multi-phased problem. once individuals become carrier of antimicrobial resistance organism, they can easily spread AMR among communities and across borders. AMR can also reach general population by spilling over into agricultural products, such as animal and aquaculture products, and also environment. So this means AMR is not an issue of only one sector. It's an issue of we all. So given this global interconnectivity web of transmission, I think we all believe that it needs a coordinated, collaborative, and multidisciplinary and cross-sectoral approach to address a potential or existing risk that originated as at animal health at animal and human interface. So that's why we need to tackle AMR using a One Health approach, not only just at global level, but also we need efforts at national and sub-national level, involving human health, animal health, and the environmental sector, etc. So given the importance of One Health, the FAO, OIE, and the WHO have been working together for years to address risks at the human-animal ecosystem interface, and their collaborative work was formally laid down in 2010 in the FAO, OIE, WHO tripartite concept note. So here you can see the cover of that tripartite concept note. This note continues to be a reference for the tripartite on the shared responsibilities for addressing health risks through multi-sectoral collaboration. Here you can see the three priority areas of the tripartite alliance, including zoonotic avian influenza, antimicrobial resistance, and rabies. So alert to these AMR quizzes in May 2015, the World Health Assembly of WHO adopted a global action plan on antimicrobial resistance. This global action plan is also developed in collaboration with FAO and OIE. So following that, in 2016, the FAO and OIE also developed their global action plan. So for the FAO is the FAO Action Plan on AMR, and for the OIE is the OIE strategy on AMR and the prudent use of antimicrobials. This two global strategy is very well in line with the WHO Global Action Plan on AMR. After developing this global action plan, the tripartite start to think about how we can help our members to monitoring the implementation of their own national action plan. So thus, later in 2018, the tripartite developed a questionnaire and for the countries to evaluate the implementation of their national action plan. So this questionnaire sent to members and led by WHO. So this questionnaire require the human health sector and animal health sector and other sector involved in AMR control answer this questionnaire together. And be noted, this is a country self-assessment survey. So since 2018 to now, the tripartite published several reports on the WHO website. So here I put a link of their overview of these self-assessment questionnaire here, and you can just click and to see how about your country. And also at the regional level, as you can see in the previous slides, actually a lot of antimicrobials was used in both human and animal in our region, and also I think also in Africa. So this need our region to be more proactively to respond to these AMR threats. So about 10 years ago, we start to consider whether we need a regional tripartite group to discuss how we should combat this issue at human and animal interface. So after then, we establish a regional tripartite group that coordinate issues in our region. And led by this tripartite group, we organize a meeting which is multi-sectoral coordination meeting at human, animal, and environment interface that gather participants from different sectors, which including human, animal, and environment sector in this meeting to catalyze multi-sectoral collaboration in different countries, and also encourage the countries to establish a functional and sustainable One Health mechanism in their country. So this meeting picture attached here is an 8th meeting, which is organized in 2019 in Bangkok. And in this year, we will have the 9th virtual meeting in October. Because this meeting will be a virtual format, so we will have very limited time to discuss all the One Health issue. So the tripartite agree to organize 3 side events to discuss these 3 very important topics. So one is AMR and food safety webinar. I think this one is most relevant to the participants today. So this one is scheduled on 29th to 30th September. And we also plan to have a wildlife health webinar on 8th September and a rabies webinar on 28th September. These 3 set webinar will live stream on YouTube. So I guess probably later, once the date is more close to the webinar, you can just try to Google and find the live stream link on the website and observe and join this tripartite event. Besides this, biannually events, we also organize series activities during the World Antimicrobials Awareness Week. So last year, we organized a webinar focused on United to preserve antimicrobials across the Asia Pacific region. So this time, we firstly involve UNEP, the United Nations Environment Program, in this tripartite activity. So this webinar includes lots of information about how environment sector can contribute to AMR activities. Besides this, the tripartite group also developed several awareness videos for our region. So there are 2 videos actually. The first one is Don't Let Antimicrobial Resistance Take Control. And the second one is Stop Spread of Antimicrobials Resistance. So these 2 videos are available on the OIE regional website, and I believe this should also be available on the WHO and FAO website. These videos are free to use, so if you want to organize some activities during the World Antimicrobials Awareness Week, or anytime you wish to have an AMR event, please feel free to download this video and translate that video into your local language and share with others. And I think I shared some activities about how the tripartite address AMR at the global and regional level. And of course, for the OIE, we also organize several activities relating to AMR and AMU. So for those who are not very familiar with OIE, so I just include a short slides to introduce who we are and what we do. So OIE is World Organization for Animal Health, taking care of our own mandate is protecting animal health and animal welfare. We are a scientific and technical intergovernmental organization established in 1924. So till now, we have 182 members in different region, and our headquarters is in OIE Paris, and we also have 5 regional office and 5 sub-regional office. I'm from the OIE regional representation for Asian Pacific, which is located in Tokyo. And so, as I mentioned, the OIE also developed the OIE strategy on AMR and prudent use of antimicrobials. So these 4 objectives, which are improve awareness and understanding, strengthen knowledge through surveillance and research, support good governance and capacity building, and encourage an implementation of international standards. So this 4 objective is very well in line with the WHO Global Action Plan. So OIE, we are an international standard citing organization recognized by the WTO SPS agreement. So which means we need to develop several international standards relating to animal and animal products. So noted the importance of AMR in the OIE terrestrial animal health code and the aquatic animal health code and OIE menu for laboratory diagnosis. We also include several chapters regarding AMR in these 3 documents. So here you can find information about AMR surveillance and monitoring. AMR surveillance and monitoring the use of antimicrobials in food-producing animal. Responsible and prudent use of antimicrobials in veterinary medicine, and risk analysis for for AMR arising from the use of antimicrobial agents in animals. So these international standards covers both the terrestrial animal and also the aquatic animal. And in the terrestrial manual, we also have a chapter to introduce the laboratory methodologies for bacteria antimicrobial susceptibility testing. So these are 3 of these international standards cite the basic for all the activities such as AMR surveillance and AMU monitoring and risk analysis. So several guidelines and documents also reference the OIE international standards. If you can recall, for the WHO, the WHO also have a list of antimicrobials of importance to human health. So similar to this WHO list, the OIE also have a list of antimicrobial agents of veterinary importance. So this list split these antimicrobials into 3 categories, which are veterinary critical important, veterinary highly important, and important. So these 3 categories, we offer different recommendations to the members, and you can just check the list for more information. But I think the most important thing I would like to emphasize here is considering the spread of AMR threat in our region and also at the global level, we strongly recommend all our members to phase out antimicrobials as growth promoter, and we also strongly recommend our members do not use fluoroquinolones, third and fourth generation of cephalosporins and colistin as growth promoter. We also recommend our members not to use these antimicrobials as preventative treatment in feed or water, and also not to use it as first-line treatment or extra-label or off-label use. So in order to promote those understanding and the concept of prudent use of antimicrobials, the OIE developed several communication materials, and also, of course, free to use. And so all these documents are in English, the original version, but we have several versions that translated by our members I will share with you later. And in these awareness materials, we suggest these 5 only rules to all these stakeholders, such as veterinary services, policymaker, pharmaceutical industry, and farmers, etc., to give them some, rules that they should follow when they want to use antimicrobials in their farms, or how to prescribe antimicrobials to their client. So these 5 only rules, maybe I can read out for you, including only use antimicrobials when prescribed by veterinarians, and only when needed, antimicrobials do not cure every infection. These specifically for this message that antimicrobials cannot treat virus-caused disease. Only obtain antimicrobials from authorized source and retailer. Only use the dosage and follow length of treatment and withdrawal period as prescribed. And only use antimicrobials when associated with good animal health care, and also farm biosecurity. So we developed several posters, leaf slides. All these things are free to use, and I know very great to know that Nepal government also translated the OIE awareness documents into Nepali. So here I attach the link of the Nepali version, and I believe there are also several versions in other local language like Khmer, Cambodia language, and Bahasa from Indonesia, and I think Thai, Japanese, and several other languages are also available, and also Chinese is also available on the website. So feel free to download and use in your awareness raising event. Another very important OIE activities is OIE AMU global data collection. So among the tripartite, WHO, FAO, and the OIE, it is agreed that WHO will take care of human health, AMR and AMU. FAO will lead the AMR surveillance, and OIE will more focus on the AMU data collection. Of course, the tripartite will support each other, but this is just to identify an organization to to lead one specific activities. For the OIE, we developed the global database on antimicrobial agents intended for use in animals. So this is actually a Excel-based questionnaire, but in maybe next year or 2 years later, we hope we can have an online platform that members can easily submit their AMU data to the OIE, through a more user-friendly platform. So till now, since 2015, we start to collect the data, and till now we published 5 reports. So the latest one is published in April 2021. So the data ranging from 2017 to 2019. So these slides show you the AMU situation of each region. So even though before you interpret this data, please kindly notate that not all the members can submit the actual amount of antimicrobials used in animals to the OIE, because they still need some time to develop their own national system to collect AMU data. So please be careful when you look at this data. This may not do not reflect the very actual situation, but I believe these reports still show us some trends or situation in different regions. So here, I think we really need to note that the Asia, Far East, and Oceania region seems we use more antimicrobials than other regions, which really urge us to take more actions to combat AMR and try to reduce the use of antimicrobials in animals and also in different sectors. So to help our members to understand how to identify their antimicrobial supply chain in their country, we organized several workshops on monitoring the quantities and use patterns of antimicrobial agents used in animals in several countries. So this is an in-country workshop. So we are quite lucky. Since 2017, I think we organized almost more than 10 workshops in different countries. And we are also very happy that since 2019 to 2020, we have about 6 or 7 workshops in our region, and very happy that Nepal also kindly accept our proposal and had one workshop in 2019. So this slide shows you a very typical AMU supply chain in our region. So in this picture, you can show how the antimicrobial entered the country, how it was produced, how it was disseminated to different stakeholders, and how it reached the end user, which are farmers and vets. You can see from the supply chain the flow of the antimicrobials actually have several different levels, which are before the border when they import antimicrobials and manufacture, they produce the antimicrobials, and then wholesaler and retailer. Those are the key sector that distribute antimicrobials in the country. And after this AMU workshop, we hope all the members are able to identify who are the key players at each level, and what kind of data they can collect at each level, and who is the drug regulator authority for different level. So this will help them understand who should be involved in their national or subnational AMR activities, and how to collaborate with them in order to build a more robust AMU monitoring system. Again, as you see, even AMU monitoring need the involvement of human health, because for some countries, the human health cover the drug monitoring and develop the regulation for even for the veterinary products. And they also need the involvement from animal health sector, and also need the involvement from the inspection department that monitoring the quality of the antimicrobials, etc. So, which means AMR and AMU really is a thing that need multi-sectoral collaboration, and we need to address this issue using a One Health approach. Some take-home message here. Please continue advocacy for political commitment for One Health initiative and effectively address AMR by developing and implementing multi-sectoral One Health national action plan at national and sub-national level, and strengthen legislation to assure quality, production, sales, and distribution of antibiotics, and describe the roles and responsibilities of different stakeholders involved. Include AMR and responsible and prudent use of antimicrobials in hospital at community level, as well as use in aquaculture in the student curriculum. So that's all my presentation. And thank you again for the organizer invite us, and hope you stay safe in this COVID-19 pandemic. Thank you very much.
Thank you. Thank you, Dr. Wong, for your elaborate presentation. Thank you for the insight. We now move on to another presentation of the session. We have Dr. Varun Kumar Sharma with us, with his presentation and overview of antimicrobial resistance in animal health in Nepal and future directions. Dr. Varun Kumar Sharma joined the veterinary services of the government of Nepal back in 2006. At present, he works in the capacity of Senior Veterinary Officer at the Animal Health Division in the Ministry of Agriculture and Livestock Development, Nepal. As a government veterinarian, Dr. Sharma is involved in drafting policies on animal health, veterinary public health, and other pertinent issues. Transboundary animal diseases, zoonosis, and One Health are among the many cakes in his plate. Dr. Sharma has worked in a team to draft NAP AMR for Nepal in close coordination with Ministry of Health and Population as the focal officer from the Ministry of Agriculture and Livestock Development. He is continuously involved in creating awareness on antimicrobial resistance among fellow veterinarians and other professionals in the livestock sector. The work of Dr. Sharma is reflected in the initiative of the government of Nepal in building a functional relationship with all stakeholders from both the government and non-government sectors to tackle the issue of antimicrobial resistance, so as to establish a multi-sectoral coordination and collaboration, both horizontally and vertically in all tiers of government. Dr. Sharma has earned a Bachelor in Veterinary Science and Animal Husbandry degree from the Tribhuvan University, Nepal, and he has a Master's degree in Veterinary Medicine and Biosecurity from the Massey University in New Zealand. Dr. Sharma, the floor is yours.
Thank you, Dr. Susan, for your very nice presentation. So, for introducing me very nicely with all over here. So, in my presentation, I'll be talking more about the situation of antimicrobial resistance in Nepal, in animal health in Nepal, and the possible way forward. So, as the time has gone out, a bit more time has been taken. So, I'll try to be on time so that everything could be completed in the time frame. So, in my presentation, I will be talking. I'll be talking about the global context, and most of this part has been covered in the previous presentations too. So the actions made to tackle AMR in the regional level, action made to take AMR in Nepal, proposed national action plan on AMR, the AMR situation in Nepal, major antibiotics being used in Nepal, external support in AMR management in animal health in Nepal, and final concluding slides. So going through the global context, as we knew from the earlier presentation also that the World Health Organization, the General Global Assembly issued a global action plan on AMR developed in close collaboration with its tripartite members, the OIE and the FAO. So this global action plan has recognized the need to address the challenges of AMR through a One Health approach, and to this very global issue, to this burden issue, on 21 September 2016, the UN General Assembly has also adopted a political declaration aiming at combating this global threat by One Health approach in line with the global action plan. And now at the global level, WHO, OIE, the FAO are working in a tripartite relationship, and similar things are being thought and are being worked within the country and within the regional level too. So taking about the work being done in the regional level, before the Global Action Plan was approved or was accepted by all member states. So there was the regional meeting of the member states of WHO Southeast Asia region in India in Jaipur, and Nepal was also the member of that regional meeting, and the members have signed a declaration called Jaipur Declaration, and which agrees to regulate the use of antimicrobial agents to prolong and preserve their efficacy in the region or in the global context. So this regional initiation has also proved has also become a catalyst event to board the AMR related activities in the national levels. So now going to the national level, now Nepal has drafted a very early version of National Action Plan in 2016, and it was done by Ministry of Health and Population, basically. So the concept of One Health was not that much accepted in that National Action Plan. So thinking about the role of the One Health stakeholders to combat AMR at national level, so all the stakeholders sat together, and we thought and we worked and we agreed that this National Action Plan, which has been drafted in 2016, needs to be updated and to be aligned with the strategic objectives as set in the Global Action Plan with multi-sectoral involvement. So we all work together. So this National Action Plan that has to be developed, or that has to be adopted by the country, needs the effort from all sectors, both from public health, animal health, the food, and the environment sector. So we all four sectors sat together, even our partners WHO and the FAO and other partners were also there in the meeting, and we finally agreed to develop the National Action Plan as per the Global Action Plan. So these all sectors, the animal health, public health, food, and environment, are actively involved in the revision of the drafted National Action Plan. Now, this National Action Plan has taken a shape. It has been reviewed by the WHO, by the FAO, and other stakeholders also in the regional level, and now it has taken a good step. So we all hope that we can go to the National Action Plan, we can endorse the National Action Plan from the Council of Ministers and take it into the implementation stage. So what are the goals, vision, and strategic objectives in the National Action Plan? I will just briefly mention about these things in this slide. So we have taken a goal to effectively combat antimicrobial resistance in Nepal by taking the One Health approach and contribute towards the global effort to tackle this public health emergency. And our vision is to reduce the mortality, morbidity, and economic impact of antimicrobial resistance in Nepal. The National Action Plan has been developed in a way to establish collaboration amongst all relevant stakeholders and strengthen governance mechanism, as well as the capacity of all stakeholders to confront and the cause and the impact of antimicrobial resistance in Nepal. The proposed objectives of NAP-AMR, we have basically 4 objectives, and the first one is to define strategic priorities, the key action and activities, responsibilities, collaborations, and indicative timelines for each strategic priority to slow the emergence of antimicrobial resistance in Nepal and strengthen the organizational and management structures to ensure intra and intersectoral coordination with the One Health approach. And basically the document is basically focused in this first objective. So most of the document has addressed these objectives that we have said in the first part. And the second part of the NAP-AMR is to perform budgeting and cost analysis for each strategic priority, because this National Action Plan has to be implemented by different line agencies or different stakeholders. So we have tried to make budgeting and cost analysis for each priority objective, and we have tried to make the sectoral inputs to find out the budget allocation, so that the government of funding or the funding from other supporting agencies could be done in a better way. So we are working at present. We are working in this part. And the third objective is to combat AMR in Nepal through a better understanding and awareness of AMR. Though we have been working in this part, we have been celebrating Antimicrobial Awareness Week and other activities, but still this activity is also envisaged in the National Action Plan. And the and final objective is to enable monitoring and evaluation of NAP-AMR implementation and progress based on the M&E framework. So this M&E framework has been adopted as per the National Planning Commission monitoring and evaluation framework. So we have tried to adopt the National Monitoring and Evaluation framework while preparing the National Action Plan on AMR. This proposed National Action Plan on AMR has 5 strategic priorities as per the Global Action Plan, and also and we can see the similarities with the priorities of the objectives set by the FAO Action Plan as well as the OIE strategic priorities. So more or less, these priorities are in line with the Global Action Plan. And for these strategic priorities, for these 5 strategic priorities, we have set 19 objectives, and we have set 33 strategic interventions and around 126 activities. So we are at present working at sub-activities level, and we hope to complete it very soon. So I will go a bit in detail with the proposed National Action Plan. So our 5 strategic objectives are in line with the global objectives. So the first priority objective is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. Strategic priority second is to strengthen the knowledge and evidence through surveillance and research. The third priority strategy is to reduce the incidence of infection through effective infection prevention and control. The fourth strategic priority is to optimize the use of antimicrobial agents in health, animal, and food. And the fifth strategic priority is to promote investment for antimicrobial resistance activities, research, and innovations. In the first strategic priority, we have 2 objectives. So the first objective is to increase awareness and understanding on antimicrobial resistance and use of antibiotics through effective information and communication. So these activities, this objective, based on this objective, we have set different activities. So these activities these sectoral intervention and activities have been targeted to different stakeholders or different agencies. So we have identified the roles and responsibility or the lead and co-leads for achieving these objectives. So we have find out the activities at the individual sectoral level. And the second objective is to improve knowledge and capacity development by the key professionals and related stakeholders on antimicrobial resistance and its containment through the education and training. In the second priority objective, strategic priority, we have taken 2 objectives. And the first one is to strengthen national surveillance system and coordination structure for antimicrobial surveillance in human, in animals, in food and feed, and the environment sector. And the second objective is to strengthen microbiology laboratory capacity for antimicrobial resistance surveillance in human, veterinary, food and animal, and food and feed sector, including the agriculture and environment sector. So the second one is basically second objective is basically focusing on the strengthening of the laboratory capacity and generating more evidence for the policy decision making. And the third strategic priority, we have taken 4 objectives. The first one is to develop and implement infection prevention and control plan and intervention in healthcare setting, strengthen infection prevention and control in the community to limit development and spread of AMR. Third objective is to develop and implement infection prevention and control plan and interventions in veterinary settings and animal husbandry and food sector. The fourth objective is to reduce environment contamination with antimicrobial residues and resistant pathogens for developing for spread of AMR. So these objectives are this part is basically we have tried to make it clear at this point because it should not be overlapping. So we have tried our best to make it clear for each and every stakeholder. So what could they play to reduce the inspection, or how they could reduce the incidence of antimicrobial resistance at their settings. And the final and the fourth objective is to optimize the use of antimicrobial agents in human, animal, and foods. So for this, we have taken 5 objectives. The first one is to ensure uninterrupted and regulated access to high-quality antimicrobial medicines. Second objective is to establish the national surveillance system for antimicrobial use and consumption. The third objective is antimicrobial stewardship to improve appropriate use of antimicrobial medicines in human and animal health care. Fourth one is to improve appropriate use of antimicrobials in the community. And fifth one is to strengthen the legislation regarding various facets of antimicrobials. And this part is one of the core area that needs more attention, and we are trying to have more actions or more activities to achieve these objectives. The fifth strategic priority is to promote investment on AMR, and for this we have taken 5 objectives to develop the economic case for sustainable investment to address AMR. The second objective is basic and operational research to optimize, to improve infection prevention and control in human and animal health. The third one is to strengthen international collaboration to promote NAP interventions for tackling AMR. The fourth objective is to strengthen national collaborations to tackle AMR with disease control programs. And fifth one, to strengthen sub-national collaborations to tackle AMR. As Nepal has already gone into a federal state, so we have to think about the sub-national collaboration, because these 3 tier of government exist in the situation of coexistence or collaborations. It's like a cooperative collaboration. So we have to develop some sort of collaboration at sub-national level. So this priority, this strategic priority, we have thought about the sub-national collaboration too. So for achieving these strategic priorities, or for achieving these interventions, we have thought of some governance structures in the proposed National Action Plan. So these governance structures include the multi-sectoral steering committee for AMR, which is headed by the Secretary of Ministry of Health and Population, and it includes the members from different ministries like Ministry of Agriculture and Livestock Development, Ministry of Forestry and Environment, and other agencies. And there is a good representation from all sectors, so that it can take better policy decisions. And this multi-sectoral steering committee, we have already started work in this line, and though the National Action Plan has not been approved, but we have taken some decisions, and this multi-sectoral steering committee is functional at the moment. Similarly, we have the National Technical Working Committee in the Ministry of Health and Population. This National Technical Working Committee also includes the member from different stakeholders, all 4 stakeholders, and we have been discussing this NAP AMR and other issues in AMR in this committee since 2 to 3 years now. So there's a very good relationship between the members, and we have tried to generate a good working environment within the country. And these 2 are the high-level committees, and we have several technical working committees at the department level. And in the NAP AMR also, we have thought of the technical working committees at the for each strategic priority. Like for the first priority, we have thought of 2 technical working committees, and for the second strategic priority, we have again two committees, one at the public health and one at the animal health level, as well as there will be a committee, a joint working committee. And for strategy 3, we have 1 technical working committee. For strategy 4, we have 3 technical working committees, and for strategy 5, we have envisaged 1 technical working committee. So these technical working committees will work in the very ground level, and based on the recommendations, or based on the priorities set by this working committee, the multi-sector or the national technical working committees will work and will make the policy decision making. So this is the governance structure which is proposed in the National Action Plan, and which is going to be endorsed by the cabinet very soon, as said by Dr. Susan. And we are working to make this happen, because we have been working in this National Action Plan for more than 3 years now, and we hope to have the final approved document by the Council of Ministers very soon. So now going to the national scenario of AMR, we can say that there is no estimate on the burden or impact of antibiotic resistance in public and animal health settings. So though some work has been done, but we have not estimated the real burden of the real impact of this AMR issue in our context. So we have huge list of publications or huge list of information at the global or the regional level, but we need to find it at our national level, because it's very important for the policy decision making, or to make the political leadership aware about the importance of this sector. So, but it's still, we need to work in this part in our country. And but based on the information that are at hand, that are present in the publications, we have seen that antimicrobial resistance is on the rise in Nepal, and it's not only in the public health setting, but it is equally important in the animal health setting. So in both settings, we are seeing the increasing trend of antimicrobial resistance, and most of the common bacteria that we face during our work as a vet or as a medical, we find that first line and many of the first line drugs are resistant at the moment, and other second line drugs are also not working in a proper way. So resistance has been observed both in first line or second line drugs in our settings. And seeing the AMR surveillance program, we can see that the National Public Health Laboratory in the Ministry of Health and Population has been conducting surveillance in public health since long now, because they started in 1999. So it's a long time they have been working this part, and they have started from very small scale, and now they have enlarged, or they have developed more capacity, and they have started to work in large scale at the moment. So at the moment they have included 21 public health laboratories and 1 animal health laboratory. Our Central Veterinary Lab is also involved in this national surveillance system being run by the public health laboratory. And the lab-based AMR surveillance in public health started in 1999 with the technical assistance from ICDDR Bangladesh. So it's the Diarrhea Research Institute. They initiated the work. They supported to start the work in Nepal with the inclusion of Vibrio species, and they started to work in Nepal. The public health lab started with the Vibrio surveillance over here. And the surveillance continued, seeing its importance. It was later on supported by USAID, and the support was continued till 2004 and 5. And from 2006 onward, it's being supported by WHO. So at present, WHO is supporting the National Surveillance Program at the Public Health Laboratory. And so the National Public Health Laboratory is working as the focal lab for the coordination of AMR activities in public health setting, and Central Veterinary Laboratory is working as the focal lab in animal sector in Nepal. So CVL is working as the focal lab for the animal health setting. So if we see the history in public health setting, it started in 1999 with the support from ICDDR. And later on in 2002, they included Salmonella typhi and Paratyphi. In 2009, they started for ESPL. In 2013, they added MRSA, and in 2016, they have added Klebsiella and Acinetobacter. So this surveillance system is ongoing and is being supported by WHO at the moment. So the National Public Health Lab, they are currently working on 10 organisms of interest. So among these 10, 8 are glass pathogens. So except Vibrio and Haemophilus, the Shigella, Streptococcus, Neisseria, Salmonella, E. coli, Staphylococcus, MRSA, Klebsiella, and Acinetobacter. These 8 are glass pathogens, and 2 are not the glass pathogen, but they are the pathogens of interest, and NPHL is currently working in this part, and our veterinary lab is also supporting in this surveillance activities. And talking about the antimicrobial resistance in animals in Nepal, so we can see the few research and limited data at CVL, and veterinary laboratories in different provinces in Nepal has been working in this part, and the results have shown that E. coli, Bacillus, Campylobacter, Salmonella, Pseudomonas, Staphylococcus, Streptococcus, these agents are commonly isolated from the animal samples, and these pathogens have developed resistance against the commonly used antibiotics like gentamicin, amoxicillin, enrofloxacin, ceftriaxone, and even colistin. Though the test for colistin is not the gold standard, we are trying to update the test as per the OI standard. But even in the tests that were being done, it shows that some sort of resistance has started to develop against colistin. So we are trying to validate it with more realistic testing. So we will be seeing this results very soon. But still, colistin resistance has been observed. However, but even though we have been conducting all these works, though there was no structured surveillance system in the past, so we try to work out more in this part, and because we need to have structured surveillance system in animal setting to estimate the burden of AMR in livestock species. So the government started to work in this part, and with the support from different agencies, from Fleming Fund as well as from the FAO, we have tried to build up with the surveillance system in animal setting. So this will definitely have the information that will be generated from the surveillance system will help us to make some evidence-based policy decision making. So we are working this part at the moment. And if we see the current AMR situation with the passive surveillance work being done at CBL, because this central veterinary lab receives the samples from clinical cases, from the postmortem samples, or from the cases brought at the central veterinary hospitals, or from other other hospitals and diagnostic labs. So they receive the samples, and if we see the trend of results, so and we have collected the data of 2018 and 19. And out of 212 isolates seen in that fiscal year, we found that E. coli is a common isolate with more than 70% occurrence, and followed by Salmonella, Staphylococcus, Klebsiella, Enterococcus, Enterobacter, Acinetobacter. And so among these agents, most of them are of global concern. These are GLAS pathogens. So we are observing pathogens with global concern in animal health settings in Nepal. So as these pathogens have been isolated in the clinical cases, so these agents are causing some clinical problems in animals, and we are seeing these agents in the animals in Nepal. And if we see the pattern of resistance, so we can see that E. coli is getting resistance to most of the aminoglycosides group. So previously we have huge use of gentamicin, and we can see that the 50% of the pathogens has developed resistance to E. coli, and 14 are going to develop it because they are in the intermediate stage. So the trend of use of gentamicin against E. coli definitely has resulted into more resistance to this agent. And in the later part, because we have started to use amikacin in the later stage, mostly in the poultry sector, so still this resistance in amikacin is also developing. We can see 20% resistance has already started. We can see the resistance to E. coli with amikacin. And against quinolones also, we can see very high resistance with enrofloxacin and ciprofloxacin. These agents were being used in animal setting for long now. And for tetracycline and amoxicillin, as spelled out in in our opening remarks also, these agents are were used in huge amount in animal health settings. So definitely it was being used in Nepal too, and these were among one of the first choice drug to the most of the practitioners, but we can see the resistance, increasing resistance to these agents. And for cephalosporins and carbapenem, so we can see that these agents are very new, because use of cephalosporins is not that has not been used that much in animal setting. So these agents are relatively new agents compared to the previous ones. So, but still we can see the start of developing resistance against the cephalosporin, ceftriaxone, and about the imiperidone, this carbapenem. We have not used this agent in animal setting, but still we have observed 3% resistance with imiperidone. So most probably it's we are getting some resistance, or some resistance genes are being transferred from human pathogens to the pathogens that are causing problem in the animal settings too. So for seeing all these evidences, we have designed a surveillance plan in animal health setting, and we have tried to change the ideology that we will be looking after the healthy animals, and we will be targeting healthy animals for this surveillance, because these healthy animals will be ultimately moved to the food chain, and it will go to the public health setting as well as in the food cycle. So we have to think about the antimicrobial resistance and residue in targeting to the healthy animals. So we have thought in that way, and in the first stage, for the first stage, we have plan to work in the broiler and spindleless poultry population, which will ultimately move to the food chain. And gradually, in our surveillance plan, we have thought of working in the dairy and other livestock species, which are in the which will be piloted in in the different scales, because we will start with the poultry in the first site, and then later on we'll move with the dairy and other livestock species. And at present, for the active surveillance is being conducted from the support with the Fleming Fund country grant, and we are trying to collect 880 samples from 4 different areas of the country at the moment. Now, target bacteria for the surveillance are E. coli, Salmonella, Enterococcus, and Campylobacter. And if we see the antimicrobial use in livestock in Nepal, so we have collected the data from 2018 and 19. So these data were reported to the OI also. So these are the gross data, and we have not been able to go up to the animal species level, but still we have tried to collect the data. And in very 2018, while we submitted the first report, the data shows that the data of 2018 and 19 shows that 19 data are a bit less compared to 2018 data. So it raises a question whether AMU is decreasing in Nepal, or it may raise the question like that. But definitely 2018, it was our first attempt. So data was the data that we have collected may not represent the actual use, but with the more triangulation of data and with more information being collected from different settings, so 2019 data is a bit more realistic data, but still it shows that the use has not gone down, except few drugs like penicillins and macrolides. So in these two ones, we can see that these two agents are and the volume of the use of these agents has gone down, most probably with the government intervention, because the government of Nepal has introduced a policy in which we have stopped the import of antimicrobials to be used as growth promoter in any form. So with this policy in action, the antimicrobial use of macrolides has gone down, and definitely it has supported our interventions to reduce the antimicrobial resistance in animal setting. With all these things, we see lots of challenges ahead of us, because as we are one of the underdeveloped or developing country, and the legal issues and the issue of overlap between functions are very crucial among us. And the major thing is that the Drug Act, which regulates all these issue of veterinary drug, was drafted long time back, and it's not adequate to address the issue of veterinary drug and antimicrobial resistance at the moment. So it's one of the big challenge for us. And the standard treatment guidelines for animal health workers or for the different animal diseases are not developed, and though it has been adopted in public health setting, but we need to work in this part. It's a big challenge for us. And drug available in the market could be brought without the prescription. There is no adequate monitoring and quality assurance system in place for these drugs. And also the irrational self-administration or prescription is one of the major challenges for us, because the farmers try to get the medicines of themselves, and they are using it in the same way. And the laboratory aid to diagnose the problem or to diagnose the conditions for choosing the best antimicrobials are also very limited, or are not being used by the practicing veterinarians. This is one of the challenges for us that needs to be addressed. And use of antimicrobials as non-therapeutic drugs as growth promoters in animals, though it has gone down, but still we are seeing some cases. We have generated some evidence that some malpractice has been ongoing. So we need to check these points, and these are also one of the challenges for us. And with drug withdrawal period after using any sort of drug or antimicrobials, it's not given due attention, not by the farmers or by the practitioners. So we need to work in this part, and it's a big challenge for us, because we have different set of practitioners, and this is definitely it's a big challenge. And the surveillance activities do have started, but it's in very initial stage, and we need to work, and we need to invest more in this part. So now going to the support from different donor agencies for AMR surveillance, we have got support from the Fleming Fund for in the first grant and second grant. So first grant was from 18 to 20, and second is from 2021 January to February 2022. So we have included all lab in this second grant. So this has definitely helped us to start with the surveillance and strengthen our laboratory capacity. And FAO is also supporting us in AMR activities. So the Global Health Security Program being conducted by the FAO has included some of the AMR activities, and they are working with us to increase our capacity. And the Atlas assessment of our national surveillance system was conducted last year in 2019, and Atlas assessment of 2 subnational lab has recently been conducted. So these all things, including the awareness materials, has also been published by FAO. We are working together, and this definitely has helped us to increase the awareness among the farmers and the users of antimicrobials. So in my concluding slide, I would like to say that the investment and implementation of proposed NAP is the need of the time, it's the need of the hour. So we need to endorse it very soon, and we all are working for this part. And the national action, the national AMR surveillance system need to be created in animal health, forming a network of veterinary laboratories, not only the public laboratories, but private laboratories too, so that we can build a strong network of strong surveillance system, a functional strong surveillance system to see or to observe the trend of antimicrobial resistance. And the antimicrobial use surveillance system need to be strengthened, which will enable us to report OI from option 2 to option 3, because we are in very initial stage, and we are trying to build the capacity to collect more informations and be able to report to the global community at very disintegrated data. So we need to strengthen our system or our functions in this part. So with this all, I would like to acknowledge Department of Livestock Services and Central Veterinary Laboratory, Veterinary Standards and Quality Control Laboratory for providing me with the information to prepare this slide, and also Dr. Surendra Karki from FAO Nepal for supporting to prepare this presentation. Thank you all. We need to handle antibiotics with care. I want to just complete my presentation with this slide. Thank you.
Thank you. Thank you, Dr. Varun. Thank you for your at-length presentation about the AMR situation and activities in Nepal. Yes, we are a bit behind time. So with this presentation, we have come to the end of the presentations, and we are now moving to the panel discussion section of the program. And for the panel discussion, I would like to invite the president of the Federation of Asian Veterinary Associations, Dr. Khwaja Nizamuddin. Similarly, I would like to invite Dr. Mary Joy Gordon-Gillo, Dr. Jean Wang, and Dr. Barun Kumar Sharma as the panelists. And I would like to request Dr. Khwaja to lead the panel discussion.
Thank you, Dr. Sujan. Congratulations to Dr. Barun, a very good presentation, and also to our presenter from OIE and FAO, Dr. Mary, Dr. Jing Wang. Very elaborate and comprehensive discussions on AMR awareness and so on. In fact, we at FAO we are working in collaboration with FAO to try and build up a what we call strategy for AMR issues within the regional level. So there are some, most of it will be aligned to what FAO is trying to do. So anyway, I will move on to the questions, and this is a question answer session and maybe discussion. So there are a couple of questions. You can see about 8 or 9 questions which have been submitted by the participants of this webinar. So very interesting questions. So let's move on to the first question. Is asking about asking FAO how to simulate responsible use of antimicrobials in their global plan. What about starting from good and adequate diagnosis and following up the treatments by vets? Maybe Dr. Mary can just highlight on this issue. Thank you.
Thank you, Dr. Khwaja. First, good afternoon, everyone, and apologies for being not there presenting live earlier, because we were in another training that's overlapping. So I think that's a very interesting question, and indeed this is where our veterinary expertise cross health communication should come in. So I think a lot of the work is being focused on initially on public health. But as I have shared with you, this is also a concern in animal health. And as veterinarians, I think first and foremost, our role with protecting animal health is important as much as protecting public health. But in this situation where majority of the communication, the messages have been centered on public health, it really becomes much more challenging to convince producers, with the carrying the messages of public health. But there is the way would be, of course, for us to look at the importance and the production, like the angle on cross-cutting interventions such as infection prevention and control, on biosecurity. These will all still, we need to be conversant on what they will understand and what will be appreciated. So I think when we convert our messages into languages of productivity, improved animal health, I think that will still, it will be better heard in a way. So, and also I think it's everything is working in parallel. So it's not just sending the communication, but as mentioned also earlier, there are really many gaps in veterinary services at the moment. I think not only in Nepal, but across the globe, particularly in developing countries. And I think and addressing those will be fundamental, such as access to improved diagnostics, access to easier like on-farm diagnostics and all these things, more effective and more cost-effective interventions on cleaning and disinfection. So I think these are the things that will probably equip those who are going to make decisions. Now, to facilitate ease, what we have been doing is connecting surveillance with practice. So eventually what I would foresee is that this surveillance data will be transformed into treatment guidelines, so that eventually veterinarians will have an empirical basis for empirical treatment. Meaning in Nepal, what are the antibiotics that should be avoided when we have, say, fowl cholera? Because we know from the routine surveillance, you already have this long-standing data. Maybe what we are also trying to do is harmonize the testing methods across the countries, so that even the data from other countries will be useful for Nepal. So I think this is what we are building on. So harmonizing the test methods so we can, our information can talk to each other, and eventually building treatment guidance based on those collective regional information. So this is, at least it's evidence-based, maybe not necessarily, as specific as having it's still different when you have the test and then use it right after the information. But in the absence of that, we know that it's challenging to have that always, particularly in resource-limited countries. I think the next alternative is just to utilize empirical information from different places, but also from internally from the same country. So I guess that's one way that we're doing this. Of course, alongside with this is a lot of behavioral change, like campaigns that will help more responsible and prudent use. And having the veterinarians at the forefront of this fight, I think that is where your roles are really emphasized.
I'm just going to jump in. You said behavioral change. There's a question about behavioral change. How to make that happen, the behavioral change among people, the farmers and so on. That's a very critical aspect. So you want to say something on that, the behavioral change?
Yes, actually, there are a lot of ways to do this, and there are professional ways to do this as well. It's interesting that in different parts of the world, there are different means to convey the same message pretty much, but it's a lot of it will be cultural, a lot of it will be, if you do it in a country like Philippines, maybe it will be through, I don't know, a popular actor to carry the message, or maybe through social media, but there are different mechanisms. So but again, one thing that we should not equate is getting the information does not necessarily equate to behavioral change. So there are what we call as behavioral handles, and these are like perceived notions, cultural controls. So I think these are being handled, in a way that will be appropriate. And of course, when you're talking to a vet, behavioral change approach will be different when you're talking to a farmer. But generally, I think making accessible, making good practices accessible, you cannot just always preach something and then not make it accessible, that change that you're wanting accessible. So I think first and foremost, we need to make the change accessible. So when you're saying that clean and disinfect, and then they don't have water, they don't have access to clean water, they don't have access to disinfectants, then you make it like, like you create expectations that cannot be met. So if you want to make a change, if you have, we also need to provide them the tools to have that change, to practice that change that we would like them to do. So I think in any angle, make it easy for them to practice the behavior. And I think peer pressure is also something that you would probably see. If other veterinarians see that this is now the norm, you see, this is because 10, 20 years ago, nobody is speaking about how antimicrobials should be used. And so the norm became like, when the animal is sick, okay, let's pour like 1 gallon of this drug and it will, if not, then let's put more. No one has had the counter message. And I think we are creating a new norm. And this is where our generation will probably change the game, but it will still depend on the foundational change that will happen to those who are driving this change. So I think we are at the fore of that. It will not be easy, but I think things are changing.
Yeah, question for Dr. Jin Wang. That's a question asking about how to, what is the prospect of sustainable veterinary medicine promotion to manage AMR? So I think the question is the prudent use of veterinary drugs and so on. So to be more sustainable in terms of use and avoid this AMR issue. Dr. Jin Wang, you want to say something on that?
Yes, thank you. I think this is also quite important question regarding prudent and responsible use of antimicrobials in animals. I think there are several aspects we can discuss on this matter. I think the first one is what is responsible and prudent use. I think we should understand that is only use antimicrobials when it is really necessary, and do not use it just for a no reason, and just because someone else told you you should use antimicrobials, so you just follow what others told you. And so this means we need several support from different stakeholders. So first one, I think, is we should have a very strong veterinary service that can, deliver a knowledge from the veterinarians to the farmers to help them understand, when they should use antimicrobials and how to use antimicrobials in this farm, and what kind of measures they should follow, and also the amount they should use in their farm. So to achieve that, it really we need a very strong, local veterinary service to deliver this kind of message to them. And in order to achieve that, that is another thing I mentioned in my presentation, is we should include good farming practice and prudent use of antimicrobials in the veterinary students' curriculum. So which means because veterinary students, they are the next generation and is a key group that will help us promote this concept. So really, I hope the government and also the universities should see the value of including AMR and prudent use of antimicrobials in their, their core curriculum to help the veterinary students to understand that. And another thing is, I think prudent use of antimicrobials is because normally it's the farmers who use antimicrobials, and so which means they need to approach the veterinarians to get some guidance from them. So this actually need trust between farmers and the veterinary and the local vet. So just I think this also really to have more communication and more chance to meet in person. They can build trust among themselves, and they can fully convince by the vets. I think that's lots what we can do in order to achieve a prudent and responsible use of antimicrobials. And as Joy mentioned, there are lots of ways to deliver this kind of message. We also need to consider, corporate message that farmers they can accept and how they can understand. So for some country, more picture is better, and do not use lots of words in their poster or in their communication materials. So I think there's lots of things we need to do in order to achieve that. And thank you very much.
Thank you. Just two important questions. Maybe both of you can answer. Is there any role of genetically modified organism in the emergence and spread of AMR, as well as what about probiotics? There seems to be a recent report that probiotics can cause problems in terms of resistance. Is that a problem? GMO and probiotics. To the FAO and OIE speakers, you want to answer that?
Yeah, I think this is part of the body of work on alternatives to antimicrobials, and in fact, maybe Jing might have more. Serena might have more information because OIE is a long-standing work on alternatives to antimicrobials, but of course, these are elements that are of importance to potential alternatives to antimicrobials. What we need are more information. So I think it doesn't mean that if it's something different and something new that it is already more effective. So I think we need to take things with caution as well, because sometimes these alternatives are maybe could pose more risk. So I think these are a matter of risk assessment as well as, it's the same for anything that's new. It has to go through a process of reviewing the risks attached to it, because it might be a solution at some point, but it can cause much more implication, or it has more repercussions that are not to the advantage of the overall health of animals and humans.
Yeah, that's good. Thanks. Dr. Jing, you want to comment on that? GMO and probiotics?
I think what I can share is a recent discussion we had at the Standardized meeting. And also, if you still remember, in 2019, there is antimicrobial alternatives meeting in Bangkok. I think so far what I can recall from that meeting is there is a call for interest for the partners and institutions to focus on vaccine, and I think also include microbial draft products and immune draft products, etc. I think they also identify several other areas. Probably the participants wish to look more into details after this meeting, but I see the meeting report is on the website. You probably can just check.
Thanks. Okay, there's a question. Maybe Dr. Barun Kumar can give his input. It says, what are the options suggesting to combat AMR from a realistic point of view in the middle economy nation, probably like yours? You have said a lot of things. Maybe what are the key things? Because often the issue is policy and implementation. There's sometimes a disconnect. And reality is different. No? So how do you address this in Nepal, for example? Thanks.
Thank you for your question. So I think it's really a big challenge for countries like Nepal. It's a developing country or underdeveloped country. So we have a huge set of problems. And the resources are very much limited. So we cannot invest more in one setting, and we can leave other sectors also. So considering all these things in mind, and also thinking about the level of awareness of the people, or how much people are aware about these things. So if we consider all these things together, the very basic, the very instrumental will be the communication, because if you can communicate well with all the stakeholders, though your investment is not that much huge, but you can achieve many things. So I think the communication is very prime, very important for achieving all these things. And as we can see that the level of awareness is different in all settings. So the level of awareness at the farmer level, at the pharmacist level, at the person who is prescribing the medicine, or the ones who are importing the medicines, there are different interests for different people, because the ones who are importing the drugs, they have different set of interests, and the one who are selling the medicines, they have different interests. So, but we have to communicate the benefits as well as the ill effects that the thing will do if we can communicate it in a better way, or in the way that they will understand it in a better way, then that all will solve this problem. And the second part is we have to monitor the things, because we cannot go to each and every household or every farm or every pharmacy. Or so how to make arrangements so that we can see the picture, what's happening in the ground situation. If we can just sit in the top of level, and if we can see how the things are going on, though we can use our resources in a very better way, we can in a very planned way, and how the things are happening at the custom or border point, and what the things are happening at the very ground at the farmers level. So if we can relate these things together and make some effective decisions, then that will also make some good effect. And I can give one example of policy in Nepal, because when we started to communicate with the public health sector, so in different meetings, when we presented the situation of antimicrobial resistance in animals, and when we showed the resistance trend that is being developed to the colistin, so immediate action was undertaken. So from the next meeting, which was on the advisory council for the drugs, they ban the colistin, the use of colistin in animal setting. So these things could happen if we can make communication between the sectors and within the sectors also. So we need to make better communication, and we should develop some ways to watch the things that are happening in the field. If we use these two things together, then definitely we can achieve major things in resource scarce countries like ours. But if we have ample resources with us, then we can do it in more detailed way. We can use more of the human resources. We can train them how to do it, and we can observe the things at the very ground level, and we can monitor it in a very regular trend. We can do it in that way. But for countries like ours, we have to think the first and very important is the communication, and followed with the close observation. Thank you.
Thank you, Dr. Varun. There's a question for Dr. Mary. It says, can AMR surveillance on livestock be conducted on sentinel bacteria, example E. coli, taken from the livestock environment? Do these surveillance results provide acceptable information of AMR status in livestock compared to AMR surveillance conducted from diseased livestock?
Well, I think we need to look at it in the bigger picture. There are different components for surveillance. As Dr. Varun, I missed the full presentation, but I think I saw the last slides and very impressed with the comprehensive information. But as he mentioned, like there's healthy animals, these are those that enter the food chain. So the antimicrobials that get tested here are those that spill over, like our concern are bacteria spilling over to the human population. And so the panel usually contains antimicrobials intended for humans, because what we are monitoring are antimicrobials. We're checking if the antimicrobials are, will still work in humans, given the picture coming from the animals. When we look at the perspective surveillance from diseased animals, we are wearing our veterinary hat, wondering what will be the effective treatment for our animals. And so for this, what we would be interested in are antibiotics that are specific for animal treatments. And this is where we generate information for empirical treatment later. Now, when we look at the environment, we're looking at the overall picture. So if we look at for example, sentinel bacteria, as you said, indicator bacteria, E. coli, or whatever from the environment, we already are looking at what interactions are happening at the environment. It doesn't necessarily have to be those that you can control. The reason why we're doing surveillance in animals, directly is because we know that we have an intervention. Our intervention will be managing their treatments. If you're looking at the animal environment, it gives you the picture of how interactions in that immediate environment is happening, but it's not entirely just what is within our control, like feeding or whatever, because maybe if you're looking at, say, water, there are already hospital effluent contaminations happening in the water, and you might falsely like put the blame, say, in an aquaculture pond, saying that it's their improper use. And we've seen this happen. The blame goes to the farmer because, like, but I'm not using those antimicrobials, and only to realize that these antimicrobials that they are monitoring, like it's connected to the wastewater coming from the hospitals and so all this. So I think what in any situation, in any surveillance situation, I think we need to take the context, like what are we doing and why are we doing it? Because in the end, we will be able to answer the questions we set out at the beginning. And also if we have the correct ingredients in the process. So I think, for example, if you wanted to look what's effective treatment, then we need to test antimicrobials that we use for treatments. You use enrofloxacin instead of ciprofloxacin, like things like this. These are the same families, but they have different intentions. So when we do this, this is also the reason why we make an effort to collect fecal samples rather than poop samples from the environment, because once it's in the environment, it's already exposed to a lot of influence. Whereas from the poop, you're sure that only the exposures from the animal itself you will be able to control. And do not maybe it should be a good strategy that when you design your surveillance, you're already looking at interventions, prospective interventions, because you might be doing something so nice and wonderful, but have no control or have no solutions for the answers that you are anticipating. Maybe that's also not maybe not a cost-effective strategy. So I think we need to combine everything, but considering also cost effectiveness, of course, when we do the surveillance and sustainability.
Thank you, Dr. Mary. I think we are running out of time. There are a lot of questions. What will happen is the speakers will answer these questions directly. We'll answer the questions which are not answered live. And also the recordings are available, will be available in the FAO website. So one last question, Dr. Jing. There's a question about data, AMU. Where can it be accessed from? You mentioned from the website, YE website, and something like that. So some participants were requesting how to look at this AMU data, please.
Thank you, Dr. Kwaza. So I will share the link in the chat box so everyone can just visit that website and download all these 4 reports. And just for information to the governmental officials. So if you want to know more details about the position of your country, you can just write an email to the headquarter AMR department directly. So they will provide you with some more something like analysis data. So I will just put the link in the chat box. Thank you.
Good. So thank you very much to all the speakers, Dr. Jing Wang, Dr. Mary Joy, Silo, Dr. Barun Kumar Sharma, for enlightening and answering some of the questions which have been, which we managed to answer live, but we will follow up with these answers in written format. And also all the recordings will be available. The e-certificates will be available also. Like was mentioned earlier, 80% of the time you are present at this webinar. So please stay tuned. So Dr. Sujan has to take leave. So Dr. Sital is still with us. Thank you very much. And so I've concluded my part on this panel discussion, and we've come to the end. Just some last words and from our director from the FAO office from Bangkok. So I would like to thank you to all the speakers before I pass on. Thank you, Dr. Sital, and to Nepal Veterinary Association, and to FAO and VNU Asia Pacific for making this event happen. Thank you very much. So I'd like to end this panel discussion and pass to Professor Dr. Acharya Charasuta for the closing remarks. Thank you very much.
Thank you very much, Dr. Kwasa, our president. Indeed, the time is going very fast. Actually, I really impressed this webinar very much. It's very informative, and I hope that it will be very benefit for our attendees. In this occasion, may I especially greeting again to Dr. Sita Kaji Shestra, President of Nepal Veterinary Association, members and Nepal colleagues, our co-hosts of this webinar. Invited speakers, ladies and gentlemen, as the director of the FAO office Bangkok and the coordinator of the FAO FAO Collaborative Project on WOW 2021, it has been an honor for me to co-host with Nepal Veterinary Association on holding the webinar on fighting the invisible pandemic of antimicrobial resistance, veterinarians, and the One Health approach on food security and food safety for a healthy life on August 25, 2021. This webinar is the key point on how to manage the livestock production for food safety and food security in our region. To tackle the invisible pandemic of AMR, I would like again to state the antimicrobial stewardship is to keep balance between antimicrobial use and the antimicrobial resistance. This is the direct action of veterinarian individual as a profession to preserve the effectiveness and availability of antimicrobial drugs through conscientious oversight and responsible medical decision-making while safeguarding animal, public, and One Health approach. Is this really for the veterinary service is very important. On behalf of the FAO office in Bangkok, the project coordinator and our co-host, Dr. Sita Kaji Shestra, President of the Nepal Veterinary Association, the committees and members, I would like to express our sincerest gratitude to Dr. Kachen Wongsathapongchai, Regional Manager, Emergency Center for Transboundary Animal Diseases, ECTAD, FAO Regional Office for Asia and the Pacific, Dr. Kwasa Nisam Matin bin Hassan Nisam, FAO President, on their honorable opening address and being our panelists. Our esteemed invited speakers, Dr. Mary Joy Gordon-Sillo, AMR Regional Project Coordinator, FAO Regional Office for Asia and the Pacific, Dr. Jing Wang, Regional Veterinary Officer, OIE Regional Representative for Asia and the Pacific, Dr. Barun Kumar Sharma, Senior Veterinary Officer, Ministry of Agriculture and Livestock Development, Nepal, on sharing their excellent lectures. Our moderator, Dr. Sujan Rana, Senior Veterinary Officer, Department of Livestock Services, and member of Nepal Veterinary Council, Nepal. VNU Exhibition Asia Pacific on jointly organized this webinar with a great success. Importantly, at last, this year, FAO and FAO Collaborative Project on empowering veterinarians in Asia toward fulfilling their roles on the Global Action Plan on Antimicrobial Resistance has already been conducted many activities on celebrating the World Antimicrobial Awareness Week 2021 in this coming 18 to 24 November this year. This webinar is one of the activities on AMR awareness of veterinarian, Veterinary Association, and students among the Asia Pacific region, which FAO would like to invite our members celebrating this event together. In addition, FAO is now launching the poster that you have seen now, the Wild Farm Design Challenge 2021, in theme of improving biosecurity features in small to medium scale pig farms in Asia. The contest application period is onward till October 15, 2021. Further information, please visit our website www.fawamember.org. FAO look forward to more collaboration in the future ahead. Stay healthy and safe. Thank you very much.